Later this month, the state's largest school district, Milwaukee Public Schools, will be going mask optional. Joining us now is Dr. Jeff Potoff, UW Health's Chief Quality Officer. We always appreciate you being with us. Let's talk about this whole mask optional thing. It seems like a lot of area school districts have already gone this route. MPS is now going to be going this route. Your feelings on it?
I think for a lot of school districts, it probably is okay to go mask optional. Reasons for that, cases are very low. We're not seeing a lot of transmission in our communities. I think if there was one thing that might lean me towards extending masks for school-age kids is if you have a very low rate of vaccination amongst those school-age kids. We know that the uptake of vaccines has been a little bit lower. If that was really low, maybe I would have second thoughts. But for most school districts, at least right now with cases low, it's not necessarily a bad call.
And just sticking with the masking topic for a moment, do you think, say even 2-3 years from now, and I know you don't have a magic 8-ball in front of you, but do you think that masking is going to become more of the norm, that it's just going to kind of be a thing that some people choose to do for whatever their personal reason is, but we should kind of get used to seeing that more and more?
My hunch is yes, not in the sense of like mandates and things like that. But, even talking with my colleagues, if we had some trip coming up that we wanted to be healthy for and it was flu season, we might just wear a mask for a week or two before that trip to ensure that we don't get sick and have to cancel our plans. I think you're going to see more of that moving forward just because folks have found it's not that big of a deal to wear a mask, and it's really inconvenient to get sick sometimes. So I think putting those two things together, you could see this, especially during our typical influenza season.
And I don't know about you, but it always seems like the sickness hits right before the vacation or right during the vacation. So whatever you can do to try to prevent that. Let's talk a little bit here about where we stand in terms of COVID numbers here in the U.S. I know in Shanghai, for example, and we've shown video here on Fox 6, the city is just desolate. They've put lockdowns in place. There's a major COVID-19 outbreak. Do you ever foresee that happening here in the United States?
No, I don't think so, especially at this point in the pandemic. In the early days of the pandemic, when no one had any protection against COVID-19, there maybe is some logic to lockdowns where you really prevent the disease from taking hold. Today we have vaccines available. We have individuals who are protected against severe disease with vaccines. People who have recently had COVID are likely protected. It probably wouldn't be worth the cost of a complete lockdown because if we didn't have a complete lockdown, we'd see some cases. You might see hospitalizations, but nothing that would overrun the healthcare system. So I think at this point, you might see targeted masking in certain areas, but citywide lockdowns that are really, really strict. I don't think you're going to see that here at all.
It would be naive of us to think that there is not going to be another novel virus that emerges at some point down the road. I think, and I can speak personally, I'm afraid that this is the route that things are going to continue to go every time something new emerges. Can you talk to that and speak to that for a moment?
Yeah, I think there could be new novel pathogens, and each one's a little different. But for something that's, say, a respiratory disease like COVID-19, where we start with out a lot of immunity, I think you will see some increased conservatism as far as what we do to protect the population. And then I think, what would be helpful is a unified approach. There's a right time and a place to use mask mandates, social distancing guidelines, and then there's a right time to loosen those things. And I think with the recent experience we've had with COVID, we could probably do that a little bit better as far as communicating that out to the public, the timing of that. But hopefully we're not talking about that for a long time.
We have learned a lot in the last 2 years. Dr. Jeff Potoff, thanks for being with us today.
Thanks.